The Paradigm trial was a very important study, investigator-led study by Dr. Amir Fati, one of my good colleagues and friends. This was a huge effort where they actually randomized patients to azacitidine venetoclax versus standard intensive chemotherapy 7 plus 3. Now, the background for this study is that for the last 45, 50 years, we've been using standard intensive chemotherapy with 7 plus 3. Now, this is a good regimen, achieves remission in about 50, 60%, but is associated with a lot of toxicities, GI issues, prolonged hospitalizations, transfusions, poor quality of life, high ICU need. So, with the emergence of azacitidine venetoclax in the older unfit population with high remission rates, we thought that it could do as well or even better in a younger population and potentially challenge the historical 7 plus 3 with less toxicity, more time outside the hospital, and overall less cost to the healthcare system. Now, this randomized study importantly allowed patients 18 to 75 years of age, but it excluded three very critical populations because those patients already had other very good standard of care. This included FLT3 mutated AML, NPM1 mutated AML below 60, and core binding factors. So it's really important to highlight that the Paradigm study did not include these three patient populations, and so the data from Paradigm is not relevant at this time for those three populations. It allowed everybody else, 18 to 75. Overall, the study showed that AZA venetoclax had higher CR rate, higher CRC rate, higher event-free survival, which was the primary endpoint, and overall survival were similar. But then again, Azaven had less time in the hospital, less ICU stay, less readmissions, less infection, less transfusion, and equal to better quality of life. And they're looking at it as a cost analysis and likely will be better. So I think it shows that for patients who are older, let's say above 55, 60, and a lot of those patients in that study had adverse ELN features. So those patients may be suitable to get Azaven as a frontline induction followed by allogenic stem cell transplant.